brief intro for Jessica Charles and her team. So for context, Jessica is the development director at Kupenda, and she is kind of the person that we've been in touch with ever since they started using ComCare. And so they originally had reached out through Wolfie's class at BU, and they have continued to use ComCare ever since. So I'm kind of excited for Jessica to share her experience and learning how to use ComCare and how it's facilitated their work at Kupenda. So I'll let you guys take it away. Let me know if you have any trouble sharing your screen, and I'm happy to do that on my end too.
Okay, sounds great. Thanks, Sam. Let me see. Can you guys see anything yet?
Yep, it's coming up.
Okay, so you guys see the slides.
It's perfect.
Okay, great. Well, thank you very much for this opportunity to talk about this project. It's been life-saving for our kids during COVID, and it's been an honor to work with the Dimagi team, but also through your collaboration with Boston University. It's been hugely supportive because we are a very small organization, so we're happy to have this product, but also the support. So let me just dive into what we've been doing, and then I'll have some Q&A at the end. So I am going to give a very brief overview of global disability and who Kupenda is, just to give you context for this app so that you can have a sense of, why did we develop this and why is it important, particularly during the pandemic. Then I'll go through some of what we've done with ComCare, which is actually 3 different apps, and we've landed on this final product that we're going to scale in the coming months. And then I want to talk about the impact of this work in terms of what we've been able to measure so far and next steps for getting it out into the world, and if anyone is interested in being involved, how they can do that. So global disability, there are actually 1 billion people living in the world with disabilities. That's 1 in 7 people and 15% of the population. And 80% of these people live in low and middle income countries. And more than 500 million of them are children and youth. So there's a high prevalence rate in low and middle income countries. Part of the problem for caring for these children is that they are widely believed to be cursed, or their disabilities being the product of witchcraft. So not only are they believed to be sinful and cursed and the product of witchcraft, but their families are as well. So they are isolated in many cases, ostracized from society and from gatherings and from services like education and medical care. A lot of people believe that they're contagious, that maybe their parents' sins have caused their disabilities, that the contraception use may have caused disabilities to come into their families. So this widespread belief is the root of a lot of problems that these children face in accessing care. A lot of the children spend their lives in isolation. I have met families who tell me they have 3 children, but they're not counting their 4th child, or no one realizes that they have a child with a disability at home because they've hidden them their whole lives. They're considered to be useless in many ways and not of value to the family or society, and so they suffer a lot of neglect and abuse. And in many cases, they are even killed at birth because the family just feels overwhelmed by the burden, both physical and emotional and social, of taking care of these children. So as you can imagine, this results in a lack of access to services. Only 10% of children with disabilities ever receive an education in Kenya. They have a difficult time accessing services. In many cases, the providers won't see them because they have what they consider other priorities, or the ability to access services like schools and health facilities are not an option for them because the transportation services won't pick them up, or their families are unable to carry them far distances because their disabilities make it impossible for them to walk. Very few of them will ever be employed, and they are excluded from all social aspects of their communities. So who is Kupenda and Kuhenza in relation to this problem in Kenya? About 20 years ago, this woman on the left, her name is Cynthia Bauer, and she went to Kenya as a wildlife biologist. And she was actually studying there when she kept driving by on the way to this forest. this school for children with disabilities, but there were no children there. And Cynthia was born with one hand, so she's sensitive to disability issues anyway. And she said, why are there no children at this school? This is very odd. And her field assistant said, well, you should talk to my cousin Leonard. He's a special needs educator and assessment officer. He might be able to tell you more. And so that's Leonard there on the right. So Leonard met Cindy, and he said to her, there's nobody at the school because nobody will pay for these kids to go to school. And at that time, it only cost $15 to send them to school, where they would get education and therapy and 3 meals a day and socialize with other children, but no one would pay for that. And so Cindy went back and was telling the story to people at home, and people started to say, well, I have $15. I'd love to help out one of these kids. And over time, every time she went to Kenya to do her field work, she'd come back with more stories and pictures, and she had all these people wanting to support the kids. And the work was growing so big that she realized, okay, I can't keep carrying all these buckets of money to Kenya. I need to actually organize into a nonprofit. So she did. And in 2003, she started Kupenda. And in 2007, Leonard registered Kuhenza on the Kenyan side. And both of these words mean love in Swahili and Giriama, which is a local dialect. And their mission was really to show love to children and to help them to feel included and access services and understand, and for the communities at large to understand that these kids are worthy of love and inclusion. So originally the work was really focused on direct service, getting them into schools, getting them into medical care, getting them out of crisis. But then in 2009, something happened. One of the kids' teachers, Winnie Gona, passed away. And when they asked what had happened, they were told that Winnie had HIV and she had gone to her pastor. And the pastor had said to her, you need to stop taking medicine and start praying and fasting, and God is going to heal your HIV. She did that and she died. And so Cindy and Leonard started to think, man, if this could happen to Winnie, what else are the pastors saying to people in the communities about health services and specifically about our kids with disabilities? And as you can probably guess, there was a huge influence. 83% of the population is Christian, 11% Muslim, and traditional healers see 2,000 people a year on average. And these leaders have a huge impact on the way that the community sees different health issues and disability and how they seek services and how they treat people with disabilities. And so a lot of these healers will, and even Christian pastors will do exorcisms. Some of them are quite painful, things like cutting and burning the child and the child's mother, definitely encouraging them to pray and fast versus seeking services, or just in some cases excluding them from their places of worship because they don't want to be seen as associated with these people. And so a big part of what we realized our role was in helping children with disabilities was educating these leaders about disabilities and helping them to understand the scientific causes and the legal obligations to care for these children, both under Kenyan law and under international law. And so we started arranging these one-day disability workshops tailored for different leader groups. And they went through all of these common disabilities and how these leaders could get involved in helping these children. And then at the end of each workshop, they said to them, you now understand the causes of disabilities and you can have an impact on improving these children's lives. And let's make an action plan and see if you can go out and find them and help them access services and educate your communities about disability justice. And 65% of the trainees who go through our workshops do just that. So if you've got a workshop with 25 people, about 16 of them actually go out and do this work even after just one day workshop. They're doing advocacy talks, they're visiting the kids, they're connecting them to services, they're opening schools, they're working with government leaders to create policy change. And it's been very effective. It's been so effective that people in other organizations and agencies all over the world are using this model and educating their leaders to identify and care for children with disabilities. It's also a really cost-effective model. So the trainings are only $300, but they on average, just one training sensitizes almost 5,000 communities members about disability and improves care for almost 400 children. And so this is where the app comes in. So part of the way that we get that data is that we ask the leaders to send us back weekly reports. And they've been doing this historically by hand, writing these reports, which can be very challenging for them because many of them have lower levels of literacy or there's simply not as much of a writing culture. So although we're getting this great data, we're thinking we're also missing a lot because we're depending on these paper-based tools. So we started to think about how can we maybe introduce mHealth solutions to our work in Kenya to deal with this issue of reporting and tracking the work that we do to help these families and children. And one of the things about Kenya is that 91% of the population either has a phone or has access to a phone that they use regularly. So it seemed promising. And in January, we went out there with a software engineer who developed a very simple app for progress tracking of these children. And that app is continuing to be used today. And we have seen a 50% increase in the quantity of progress reports that we've received because of this app, but also in the quality. This is only for our staff, but they love using it. They say it's much easier than writing out all these handwritten reports and uploading all these pictures and details to a web-based platform. They can just hit submit on the app and it comes to our staff in the US and we can track the children's progress. So this was exciting, and we were happy to see that it had this great impact. And so when we were approached by Boston University, and many of you know Wolfie, Wolfie was a former professor of mine, and he said to me, Jessica, do you have a project that you might want some mHealth solutions for? Because we have this team of students who are going to be coming into my class, and we could assign them to work on something for you. We had just seen how well the app worked in January, and we said, sure, let's try to appify this local leader program. And so Wolfie connected us to these three amazing women who have been working with us now for 6 months to help us develop this product and have gone through a number of changes, and their course ended and they stayed with us. And a couple of them are on this call with us today, and I think Wolfie might be as well. And so they've been working on this product with us since February, but in February it was a very different product. So originally, as I said, we were just trying to get these weekly reporting forms into the app. They did that quickly. They got a Swahili version in, they got some resources in, it was going great. And then, as you know, the pandemic happened in March. And the pandemic shut down everything we do. All of our schools shut down, our kids couldn't access services, all of our local leader trainings shut down, the leaders couldn't do any of the public education, they couldn't visit the families, our hands were completely tied, and it was scary. It was scary because when children with disabilities don't have access to their doctors and their medicine, their families sometimes don't understand how to administer medicine, they don't always have enough food to keep the children well nourished. Particularly in COVID, they are dealing with high unemployment rates. They often can't even tend their farms because they're burdened with taking care of these high need children. And so even outside of pandemic conditions, what we see is these children come back from just 3-4 week school breaks, malnourished, sometimes experiencing abuse, sometimes being quite ill because their families don't always know how to care for them. And so 1,500 kids going home on the same day was terrifying to us. And this picture here, just to make it a little bit more tangible. This is a little girl named Janet, and during one of our school breaks a couple years ago, she did pass away because her grandma didn't know how to feed her. She had a problem with swallowing. Grandmother loved her, trying to give her food, but she started choking, and the grandmother didn't have the ability to give her the Heimlich to help her breathe again, and she passed away. And those stories do happen, so we're doing a lot of training with these families, but to somehow scale that to 1,500 families overnight was scary and impossible. And so we started to think, how can we get to these families quickly and how can we prioritize them? So we said to the BU team, can you help us to incorporate COVID screening features and home-based care screening features into the app? And they did it. They put in so many extra hours beyond what their course was asking for. They got this survey in, and we started to be able to use it to figure out who was in crisis and how we could get them care. So it started with these COVID assessments where, as you can see, these very simple questionnaires. Do you have symptoms? Do you understand how to prevent COVID? If you do have symptoms, if you think you might have been exposed, here's how to access services. Here's what we'll do to make sure that you do access services. So we got all these COVID screenings. We also got to figure out who was in need of nutritional support and deliver food to them, and also track how long they needed this food and when the food was going to run out, how many family members they had, because in these families, many times the child with the disability eats last because they are considered to be the least productive. If they can't contribute to the family income, they may be seen as less essential for nourishing. So we're tracking food delivery, and we continue to. And we are also, and this is the part that's been, I think, the most significant part of this app, is that we could identify the children who were in need of emergency services to deal with abuse, illness, medications, and nutrition. So we would get reports, for example, from 30 reports from one leader in a week, and we could say these 5 kids are really in crisis, they need follow-up today. These other kids have needs, but these ones are the emergency needs. And the app includes a guided counseling form to say, okay, call these families and start asking them these questions. Here's the way to refer them to services. Here's the way to make sure that other people in their community can support them. And that has been a game changer for a lot of our families, and we believe it saved lives during this pandemic. So here's a little bit of the data that we've been able to gather over the last 6 months that proves that we're having an impact. So we trained 13 Kenyans to use the app. In the first month of full rollout, 300 kids were counseled, which is almost more than triple what we were doing a year ago, when we just had 83 counseling sessions. We developed those tailored counseling forms that enabled us to give support for children in crisis. And we prioritized care for 338 children who were experiencing those illness issues or health issues or safety issues. This is kind of how all the data looks. So we've done, everybody's had a COVID survey. It's 510 kids and families to date. And then, as you can see, there were a lot of needs for therapy. And prior to this app, we may have tried to provide therapy support, but by using the app, we could say, yes, these children's families need training on therapy. We're going to get that to them. But first, we need to get them food and medications and abuse prevention or care to make sure that they are not in crisis and to make sure that they survive this pandemic. I'm not going to, read all this to you, but we have a feature in the app that gathers qualitative data, and it's been wonderful to get a little feedback from the families and to see them say things like, we didn't know about prevention, we didn't have the ability to get access to food and income before you came and served us with this counseling and with this care. So I'll be sharing a PDF of this presentation afterwards, but that's some of the feedback that we got that you can read through. So what is next for the project? So we're still entering content, particularly for those counseling forms. There's a number of them. We worked with some MIT students this summer to develop a GIS map that would integrate with the data we're collecting through this app. So the leaders, as you know, there's the GIS feature in ComCare that you can collect the coordinates when you're at a child's home or if you're a leader. And we're hoping soon to be able to connect our service provision, whether it's food delivery or mobile clinics or local leader outreach, to areas where there are the most number of children, and to really see where there's a lack of services based on where the children are and where the leaders are. We also, as a next phase, are looking at learning more about how to export the data we're collecting and make the best use of it in informing the development of this app and also our programs in general. And we have a lot of work to get this into Swahili. Our Kenyan staff speak English, but the local leaders, the majority of them, need to access the content in Swahili. So another big phase that will be happening as early as the end of October is really testing and scaling and using that feedback to improve the product and to improve the training so that we can scale more broadly in 2021. We are advisors to governments at both the county and the national level on disability justice and sensitization and care. We have been for 20 years, but this app is allowing us to show more data on prevalence and outcomes and needs for children that will help us with advocacy efforts, and we're hoping to have more government support and collaboration around this project, and specifically around using and distributing the app so more leaders can be involved in this outreach. We also have a number of partners using our tools, specifically our local leader training training tools, excuse me, around the world. So we have people right now in 12 different countries who have implemented our local leader training, which means, as you can imagine, there are hundreds of leaders who are now out in their communities identifying children with disabilities. And this tool, this app, would help them to have simplified reporting systems, and their staff in their home offices to have simplified prioritization and outreach and counseling systems. So we believe that this will be something that people in other countries find valuable and incorporate easily into their programs. If you want to get involved, there's a few different ways you could do that. We do still need development support. Our students most of them will be leaving us in December, and we still have a lot of work to do on developing the coding structures. If you know anyone who speaks Swahili, we'd love connections to translators. Any place else that we can share about this work with people who are interested in either joining us in this work on the field or financing it. And we recently had someone that got so excited about this work that they said, we will match any donations or sponsorship that come into your organization up to $50,000 for new donors who come to support this work through April. So sharing the word about that is also something we would be grateful for. And of course, I'm happy to talk in more detail with anybody who wants to learn more about the project or our work in Kenya.
Wow, thanks so much, Jessica. That was amazing. I'm actually amazed you were able to get through all of that so quickly. And I'm sure everyone else, I learned a lot, and I feel like I've already talked to you a lot. So I really appreciate that. And, you know, I think we know that so many of our projects that work with marginalized communities across the world, those communities are getting hit twice as hard as the rest of us. And I think, you know, your work really proves that, you know, children with disabilities who already face so many challenges during normal times face just this whole extra set of challenges now during COVID. Yeah. So for everyone else, I'd love for you guys to submit questions. You can just do that in the chat box, and I can read them off as they come in. But Jessica, I'm thinking of this mostly because we kind of had this same chat yesterday on one of our U.S. health chats. I just was curious, what have the closures? I know that schools are closed in Kenya, but can you talk a little bit about what the restrictions have been on movement and how that's affected? Like, I saw that picture of app testing and was thinking, oh, are you going to be able to do that in person? So I guess I'm curious how you guys are actually physically moving around and what those restrictions look like.
Yeah, the government's given us permission to do food delivery, but it's really, you know, we have all the PPE and we do drop-off spots where the families come and gather it. We're not doing home visits yet. All of the counseling is happening over the phone with the app. But there is a law that's allowing us to gather with groups as small as 6, which at least for the testing phase of the app does seem possible. You know, just to get very small groups, you know, get the pastors together, do a training for them, get the traditional healers together, do a training for them. And then we can really monitor, okay, you were trained on this date. Let's look at your reports that have come in. We do think that those trainings have to happen in person, but the BU team has also developed some amazing training videos for us that have subtitles. So we are thinking we may distribute the training videos if we really have to do something remote for those trainings.
Okay, great. And remind me, the BU team, because of the pandemic, never got to go on site, is that right?
They didn't, no, but they actually, we have demo calls with our Kenyan team every Tuesday morning, and they've been intimately involved in that for the past 6 months. So I do feel like they've got these great relationships growing that I hope they will be able to meet them in person.
Yeah, wonderful. I hope so too. I mean, there are so many sad parts of the pandemic, but that's definitely a big one, I'm sure, to work so closely with folks you can't meet.
Yeah.
So we have a few questions in the chat box already. The first one is, in the beginning of the project, where did you find the software developer to build the first app? And do you have any plans to build in-house app building capacity, like within Kupenda?
Yeah, good question. So full disclosure, the software engineer app developer is my partner, Steve. He and I have been together for 5 years. And so he said he wanted to come to Kenya. And he said, what can I do to help? And I said, can you build an app for us to see if it works? And he found, totally independent of anything connected to my work, he found ComCare, I think through like a Google search, and he built this app, and we thought, oh my gosh, this is perfectly coordinating with Wolfie's help through the BUM Health course. In terms of building in-house app development support, I would love it. I do think, if this tool scales in the way I think it will and hope it will, I can see really needing more in-house development support. And the question is, how long is it going to take us to do the testing and really make a case for hiring someone like that? In the meantime, having these students support us has been amazing and much more effective and productive and efficient than I ever would have imagined. So that's probably what we're doing at least for the next calendar year.
Yeah, absolutely. And I bet you have 3 interns that would be really happy if that turned into a full-time position.
Yeah, that would be. They would be awesome additions.
Awesome. So the next question is, what other tools did you guys consider besides ComCare for the mHealth aspect of it, for the app portion?
I do wish that Steve, the engineer, was with us, because he could maybe write out some of the other tools he had looked at. I cannot, to be honest, remember all of them, but he had looked at a number of different platforms, and nothing was simple enough for what we were trying to do. I mean, he built this thing on ComCare in Kenya in a week and a half. We had, and that was really, he only had a couple weeks to donate his time. So I think the more intricate coding systems just weren't going to work for what he was volunteering. And sorry, what was the second part of the question, Erin?
Oh, no, that was it. Our product team will be really happy to hear that Steve called it the easiest tool to use. I feel like that's a quote to put on the website, guys.
Yeah.
But I mean, he's also a software engineer, so
we can leave that part off of the quote. Don't worry.
Selective quoting.
Yeah, exactly. Kai, who's our engineering manager, wants to encourage you to say that you can also learn how to app build, Jessica, especially if you've got literal in-house help, if that's your partner.
That's a good point. And Wolfie, who is also, I think he jumped off, but he's always telling me, take the ComCare class, just learn how to do it on your own. So I think, fortunately, there is a professional development component of my job and budget. And so maybe that will be something that I ask for next year, which would be awesome.
Absolutely. You're talking to the SaaS division, so we're all about self-implementation. Great. So our next question is, do you have any plans to utilize ComCare as a job aid tool?
In terms of, I guess I want to understand a little bit more about what the question is about a job aid, like assisting.
Sure. Amy, do you want to pipe in if you don't mind?
Yep. You can utilize ComCare for different forms of multimedia. So what I meant by that is creating apps on how to do certain physical therapies, or potentially how to better care for different disabilities, and having certain caretakers who have access to the application to be able to have that, so that maybe when they do come home, or they're working with a new use case, they have a multimedia aspect to the app, so that they can maybe watch a video or hear something explained to them as well.
Yeah, thank you very much for explaining that. Absolutely, the answer is absolutely. There's a project called Global Health Media Project that we've been following pretty closely for years, that uses videos for training, and it's extremely successful, again, because maybe the literacy levels of some of these leaders and families might be lower. So video training would be great. I think we're just trying to think about, how to make something that's nimble and that doesn't require Wi-Fi and is not too clunky and big. But that has increasingly become something that we think about, particularly in relation to education during the pandemic, because getting these tools and resources to families, and that example I told of Janet not being able to breathe and passing away, if we could train on even CPR and Heimlich and basic therapy to the families and the leaders, I do think that would be a wonderful tool. And I think this is really the first step of getting buy-in for something like that. If they can use this for very simple reporting, then we can start to pull out, the change agents among our local leader group and really get them to engage in the next level, because they are every day asking for more training. So I can definitely see it going there.
always nice to hear that there's more demand from your users as well for extra trainings.
Yes.
Our next question is, the internal change management as a result of digital data collection can be hard to manage for some organizations. What were some challenges in helping your teams use data to continuously improve your program?
Yes, excellent question. We are definitely in the challenging part. So we're learning a lot about how to make best use of the data. I will say the exports can be a little overwhelming. So something that I've been talking with Sam and Jordan about is really getting us trained on how to make the best use of data. And so my dream is that we have 2 staff in the US and 10 in Kenya. And my dream is that both sides would be trained on data exports and reading. And really that's a component of a lot of the features that we're building right now, is that our directors in Kenya would have access to this data and be able to use it for decision making. That I will say we are not there yet. I have been making exports of data, cleaning it and sharing it with our field team for the past 6 months, but we're getting to the point that the data is getting more complicated. And I think we are going to have to create systems and really train people on how to use that effectively.
Sure, that makes a lot of sense. But I think not only from an organizational perspective is it great to have, folks that are in country able to deal with those data exports. I also think there's a whole bunch of issues around like local data ownership that make it really important to ensure that, local staff and people who are most connected to the data also know how to interpret it.
Yeah, I agree.
The next question is, there seemed to be some good, positive, qualitative feedback you were hearing from end users, which is great. Are there any issues or recommendations for improving the app that you have heard as well?
Yes. With the first app that we created, that one that came up in January, because that's being used so regularly, they've been able to give a lot of just basic edits, but they've also been able to ask for new features. And most recently they were asking like, hey, we keep collecting this GIS data, how can we use that? So as they're using the tool, I'm realizing there's more, they're able to, and that's part of what our demos are about on Tuesday too. They're able to look at the content, give us feedback on the design, but then as they're using it, they're saying, can you add this, or can you show me how to use this in a better way? The feature of taking photos was definitely something that they wanted to learn how to do it better, and again, how to really use the GIS coordinates. So that's what we're thinking about with them for this next phase, is again getting them on both the design but the testing feedback and incorporating their feedback.
That's great. It sounds like you guys have a really engaged user base too that feels really comfortable giving feedback.
Yeah, I do think that's the advantage of having worked with them for the past 20 years. It's not like a small one-year project. It's Cindy and Leonard have such a long-standing relationship that they can really be very open with each other. And sometimes Leonard says to us, no, that's not going to work. I need it like this. And that feels good.
I'm curious, do you feel like there are many requests that come in that you feel like you're not able to address, where they say, we want this feature, and you say, we just can't do that?
Yes, Swahili. Right now, that's the thing on my mind is just, I need to get the content translated so that they can use it. And they need to be able to train. So I need to also get more training videos. And then once I get, again, we only really have 13 people using this new app. So I imagine there'll be more and more feedback coming in after we train more people. But that is definitely a part of our feedback loop, is like, how is it working? But just what do you guys want? What are the new features, or what's breaking, or what's frustrating you? And they, for the most part, are pretty honest. And I hope that we'll continue to get that feedback.
Yeah. I'm curious, do you, because I remember like a lot of times when we're working with a partner, we will have their staffs, like you said, you had 10 Kenyan staff, we would ask them to translate, like we'd give them a file and say, have at it. Is it just that you feel like they have too much other work to be doing that they can't focus on it?
Yeah, I have one intern that's helping me, and I also have an intern on the US side that's helping me. But it's also, and this might be something your feedback would be helpful on, small changes are made all the time to language and to texts and to features. And so keeping up with managing all of those changes and the Swahili translations for all of those and the design edits for all of those, yeah, it's a lot for a small team. And they are literally, each one of them has 50 to 100 children that they're trying to manage and keep safe during the pandemic. So doing extensive translations for us isn't their priority.
Yeah, no, that makes a ton of sense. And the unfortunate thing too is that I know one thing we found is if you use formal translators, say you were to get some small amount of money and you could go pay for translations, it actually is really important to make sure that the Swahili translation that is used is local and relevant in using the right words. So an example I remember from a lot of our Indian maternal and child health apps is like there was a very technical word for chlorestrum for the first breast milk that comes out. And we'd always put in that hyper technical word and no one would ever understand it. So we'd have to switch it to mother's milk. Yeah. So just things like that. And I would bet with a lot of your therapies that, there's a very scientific word for it. And then there's something that will actually make sense to people.
That's so true. Even when we did the COVID survey, I kept saying, how do you want me to show 6 feet? You want me to say the length of a door, the length of a bed? And they ended up saying 2 steps, which I thought was like, 2 steps, that doesn't mean anything, but it totally translated culturally for them. So it was important that they were really writing it with me. Yeah, that's important. But the translation piece too, they go through, sometimes it takes them so long to do translations because they need all these different people to look at it and make sure it's right for their context.
Yeah, absolutely. 2 steps. That's really interesting. I haven't heard that. Okay, I've got another question in the chat box, which is, you said this program can and will scale. What kind of scale are you envisioning in the next 5 years, and how can ComCare support that scale?
Yeah, great question. So again, because so many people are using our local leader training program already, we've had funding from the UK government. We have partners, if you go on our website, you'll see you can download all of the resources for this training. And so people are using it independent of us. They're using it with us. They're flying us out to Zambia to do trainings for them. So that program is scaling. And if we can pair that scaling with this type of tool that says, not only can you get these leaders mobilized, but you can track what they're doing and prioritize the kids that they bring to you, I can see it scaling, significantly over the next 5 years to many different countries. We are still, I don't know how familiar you are with USAID, but USAID has a new partnership initiative program for people who have never received US government funding for our projects, which we have not yet. And so there's a lot of people looking at us and saying, maybe you should be our partner on these COVID response programs, on these disability programs. So depending on, again, how the testing goes and how the funding comes, we would definitely want to scale. And that's when I would love Dimagi's support about how to really show this product in new countries and allow them to tailor it for their needs and their languages and their contexts, how to make our trainings efficient and effective for them. And maybe, I think a big part with development work is that we are so in the weeds that just having someone external to come in and like look at our processes and look at our code and look at our data exports, that's the type of stuff that before we blow it up, we'd love that like external feedback on how we're doing.
Yeah, absolutely. And I think, we have so many partners that have taken the same app and grown it to be in 15, 20, 30 countries. So I think I'll say when, not if, when that happens, we're definitely happy to help you through that and also, get you in touch with organizations who have actually done it, whose ideas you might find more interesting than ours.
That would be amazing. Thank you.
We only have 3 minutes left, but I am aware that we have Caroline and Julia on the line. And I was just curious if you guys wanted to add anything to this, if you want to talk about like your favorite part, the most challenging part, anything else you wanted to add that you feel like is a really big part of your experience, to let us know.
Yeah, Erin, no, thank you. Yeah, it's been a tremendous experience working with Jessica and, starting with this local leader or community leader app and just really seeing the evolution over the ever-changing needs of the communities in in Kenya in Kilifi County. And I think that, you know, I will say one of the challenges that we're faced with right now is handling all of the case properties that we have. So just managing that and keeping it, because right now we have hundreds. And so just learning how to, as a team, figure out the best way to collaborate when figuring out who's going to go in the app at what time, and managing those case properties, communicating over, you know, what code needs to be put in, what are some of these bugs that need to be addressed so we can use the emulator. So I think it's just continuing to evolve as our team is, kind of prioritizing certain aspects of the application and figuring out, what can be tested and ultimately what is ready for maybe the training videos. So there's a lot of components to it. But I will say it's been an amazing opportunity to learn more about how to code. I am no developer, but I definitely have built some coding skills, and I think definitely I think of greater appreciation for health work. And I can pass that to Caroline.
Wonderful.
Thank you. Thanks, Julia. Thanks so much, Jessica, for doing this presentation. And yeah, it's been such a pleasure to be able to work alongside Kupenda and have this opportunity. I think that speaking about translation and making that more accessible and being able to make more accommodations around that would be really, really helpful for this project in particular, just because of the way that I think it's just evolving, like Julia said, and unfolding at such a rate that like we're going to need so many things translated. It's such a kind of high amount and high volume. But otherwise, I think everyone working on it is just so like amazing and competent, and it's just been so great to be alongside everyone. So that's really all I have to say.
Wonderful. Well, thank you guys so much. And I think another interesting part of your story that I know Sam touched on a little bit in the introduction was that, this was born out of the project, the program with BU. And it's really great for us to see that relationship flourish and for, the app to continue to have a life after your course is over and, for the next, we hope 5, 10, 20 years. So huge thank you, Jessica, Julia, Caroline. Wolfie, I know, was here and put some comments in. And you have, by the way, there are a lot of like Wolfie class alums on the line as well, including some of our staff in India who took his course when so they are staying up late into the night to hear about this. But we really appreciate this. We are an impact first organization. Impact is super important to us, and we don't get to hear from folks like you guys who are really implementing as much as we'd like to. So we really appreciate you giving up your time and letting us hear a small part of your story.
Well, thanks so much for the opportunity. It's been awesome to work with you, and we're so excited to see what's next.
Yeah, wonderful. Thanks so much. Take care, you guys.
Bye, everybody.
Bye.